Here is
So, all right. Today we are going to talk about radiation hazard. And the objective of this session is to learn about secondary electrons and their biological effect, to find the difference between deterministic and stochastic effect of radiation, and to understand the principle of radiation protection. So let's start with the secondary electrons. In last session, we learned there are two major X-ray interaction with the matter: photoelectric effect and Compton scattering. In photoelectric effect, X-ray photon interacts with the electron of inner shell of atom and eject it from its orbit. It gets completely absorbed. During the process, characteristic X-ray is produced. The ejected electron is called photoelectron. Whereas in the Compton scattering, X-ray photon interacts with the outer shell electron and get deflected. And the ejected electron is called recoil electron. So the recoil electron from Compton scattering and photoelectron from photoelectric effect are collectively known as secondary electrons. And this secondary electron ionize biological tissue and cause radiation injuries. They can ionize air chamber that can be used in an equipment to measure the intensity of X-ray or gamma rays. They can react with the silver and bromine ion, can be used in photographic film, used in conventional radiography. They can excite a material known as phosphor, a group of material, to emit light. And those materials are used in X-ray detectors, CT detectors. And finally, they can increase molecular motion of matter and increase its temperature. But today we are going to talk about secondary electrons and their effect on biological tissue. So this secondary electron can directly interact with the solute molecule, RNA, DNA, different type of proteins, hormones, enzymes, and rupture their covalent bond, the bond of proteins. And they can indirectly act by ionizing water, creating a hydroxyl free radicals. So X-ray exposure will ionize water. Our body is made up of 70 to 90% of water. So X-ray exposure first ionize water, produce free radical, and make molecular change in RNA and DNA. They can also cause a subcellular damage in cell membrane, nuclei, chromosome that leads to cell death or cellular transformation, genetic transformation. Conditions caused by cell death are known as deterministic effect, and the conditions that are caused by a cellular transformation are known as stochastic effect. So what is actually this deterministic and stochastic effect? So let's talk about this one. So deterministic effects are the condition which have threshold dose below which the effect doesn't appear. They have threshold dose and have a dose above which effect will invariably occur. Deterministic effect has repair mechanism. So the dose is not cumulative. So the dose don't accumulate. And there is one exception, and that exception is I. Cataract is cumulative. So it's a lifetime dose. And if the dose is more than 5 gray, then we can develop cataract because of radiation. So whenever we go to the operation theater, angiography shoot, it's better to have a lead glasses. So these are few examples of deterministic effect and their threshold values. Skin erythema, that means the redness of skin. irreversible skin damage, hair loss, sterility, cataract. And here is a common radiological examination and their doses. And if you have noticed, all these doses are in nearly gray, and those doses are in gray, which means in diagnostic radiology, deterministic effects rarely occur. Again, exception is cataract because it's cumulative.
So you need to go to like 500,000 chest radiographies and then you develop cataract.
True. I mean, yeah, true.
Yeah.
So this is a graph of deterministic effect. Y-axis is the frequency of occurrence of the disease. The x-axis is the radiation dose. You can see threshold dose, and the condition will never occur below that threshold dose, but it will occur after there. I mean, that dose, it's invariably occur 100%. So this is deterministic effect. So what is stochastic effect? Stochastic effect is a statistical in nature. It arises by chance. There is no threshold dose for stochastic. Risk, however, risk is proportional to the dose. So if the dose is high, risk is high. So irradiated person either develop cancer or will be unaffected. So what are the examples? Different type of leukemias, blood cancer, thyroid cancer, and the genetic disorders are the stochastic effect. And here is a graph of stochastic effect. Again, y-axis is the probability of effect, and the x-axis is dose. And you can see there is no threshold dose, and the probability of the effect increases with the dose.
So if it start increasing up 1, 5.
Yeah.
Quite unlikely.
So X-ray protection is to protect us from the stochastic effect and not the deterministic, because in diagnostic radiology, the dose is extremely low to have deterministic condition. So what is the principle of X-ray protection? And these principles are universal in every country, everywhere. So there are 3 principles of X-ray protection, radiation protection: justification of exposure, optimization of dose, and dose limitation. So what is justification? Justification is benefit should always exceed the risk. And there are few conditions we have to understand. The first one is, as I've already told you, that the risk is proportional to the dose. So we have to always remember that. Second, risk is significantly greater for children than adults because of the growing tissues. And we should always rule out the possibility of pregnancy in female patient with reproductive in the reproductive age. And it's easy to justify exposure in seriously ill patient because the accurate diagnosis could significantly affect the clinical outcome. However, strong justification is needed for healthy individuals, mammography for healthy women, and volunteer participating in medical research. Another principle is optimization of dose. Dose should be as low as reasonably achievable. So the image should be of diagnostic quality, but dose should be as low as achievable. And this is called ALARA principle. It's a very common word, ALARA principle. So optimization of dose can be done in different levels. It can be done at the level of design of equipment, and most of the X-ray CT equipment nowadays have automatic exposure control. After certain dose, it will automatically switch off. So selection of better technique. For example, increasing tube potential, tube voltage will increase the energy of X-ray and it will penetrate. Penetrating X-ray won't deposit acetose in the body. So what we do is in pediatric patient, we use high kV X-rays. So selection of better technique. Third is operator technique, that is minimal screening time. And finally, regular quality assurance to ensure optimal equipment performance. Regularly, every week, every month. Okay. And the third principle is the dose limitation. And the limit on effective dose is to restrict stochastic effects again. Because again, in diagnostic radiology, dose is well below deterministic threshold. And one thing we have to remember is there is no specific dose limit for patient. So the patient, and the exposure in patients should be justified and dose should be optimized. But there is no specific dose limit for the patient. This dose limit is for personals, radiographer, radiologist, and the public. And another important thing I would like to draw your attention is the dose to employee is almost 10 times more than general public because they are paid for their work. So they will get economic benefit. And we know that stochastic effect or the effect of cancer is directly proportional to the dose. So this is more about a theoretical aspect of radiation protection, but what can we practically do individually when you go to operation theater, angiographic sheet? Again, there are three important things to remember. First is just distance. Second is time of exposure. And finally, third is protective gear, protective clothing. So distance. X-ray, gamma rays, they are all electromagnetic wave, just like light. So the X-ray, intensity of X-ray beam is inversely proportional to the square of distance from the source. So that means if the distance is doubled, so for example, from here to here, the intensity reduced by factor 4. It's a huge reduction. So when you go to operation theater, a single step back from the patient may double the distance and reduce the dose by factor 4. Single step back. 2 step back may triple the distance and reduce the dose by factor 9. So this is all about distance. Time of exposure. Reducing exposure time is important not only for the patient, but also for the personals. We should minimize time standing close to patient who is getting radiation exposure. And finally, it's about protective clothing. Lead apron, thyroid shield, eyeglasses are used. And 0.35 millimeter thick lead apron is used for general radiography, which will reduce X-ray by 97%. Whereas 0.5 millimeter thickness for the is used for the interventional radiology. It will reduce the X-ray intensity of X-ray by 98.5%. So, if you have any questions.
Sorry, I had a few. So just on that, I had one on that last slide. So is the reason why they did go to the 0.35 is that just basically so they can actually function and still operate with like a lead?
Yes, true.
Yeah, so they're pretty heavy.
And one thing, yeah, exactly, that's true.
Yeah.
And one thing we have to remember is the attenuation of X-ray is exponential. That means X-ray can't be completely stopped, theoretically and even practically. So So that's why it's, even with the 0.5, there is 98.5%. Yeah, there is still 1.5 percent of intensity of X-ray that pass through that lead apron.
Yeah, and on another slide previously, you said that obviously children are high risk. And do you mind just kind of explaining that a bit more, like why? And we know they're high risk, but just kind of what effects make that?
Yeah, I mean, so the children are, for example, there are vulnerable tissues, reproductive tissues,
Yeah.
nerve tissues, neurons, different type of neurons, and all these tissues are growing up to 21 years. So there are all growing tissues in the children. So that is why they are more vulnerable to the radiation as compared to the adult.
Yeah. Okay, that makes sense.
So
yeah.
children are still growing. They haven't stopped growth.
Yeah, yeah. Because we had this case. It was one of Dick's cases where one of our surgeons, they had a chondrosarcoma in their pelvis, and it was she had it done when she was around 20, and then 2 years later she became pregnant, and she had a CT done to check that the tumor hadn't come back, and for other reasons, and she didn't realize she was pregnant, and she was pregnant as the first ever case that he'd had where a person had got a hemiprosthesis and become pregnant. So he had to go back and remove, because we used the SI joint, so she could actually give birth. He had to go back in and remove the screws, and just fingers crossed that she had a baby naturally, didn't have a C-section, and her pelvis just sprung open.
Wow.
It's still in there. Pretty cool. Hey?
Yeah.
Yeah, he presented it in one of his most recent journal articles, and he rang me, and I was like, can I take the screws out? And I was like, oh, you can if you want. But he explained why, and he was like the worst thing, like it loosens on the island. But yeah, I was just wondering, obviously she was pregnant when she had that CT scan done, and they didn't realize that she was pregnant. So
yeah. Again, it's
so the baby
stochastic.
was normal, apparently.
Yeah, again, it's stochastic.
Yeah.
So there is a high risk, but
Yeah.
it's a risk.
Yeah.
So we can't say, I mean, there is no threshold.
Yeah. Okay.
So,
Oh,
yeah.
that's so lucky.
Yeah, lucky.
Yeah.
Yeah, that's,
Really
So
lucky.
she said, just because
Yeah.
some of our engineers are female,
Yeah.
I was always told, I mean, you might have already explained it, but I was always told that there's more risk to women of childbearing age. That's, has it been discussed or?
yeah, I mean, the reason is that in the fetus is very vulnerable in very early phase of pregnancy, before 4 weeks. At that time, many women even don't know they are pregnant,
Yeah.
because the pregnancy test will start to show only after maybe 15 or 18 days of pregnancy. It's just then the hormone will be released,
Yes.
and then pregnancy test. So at that, so there is a rule of scanning the women, the rule of 10 days after menstruation.
Yeah.
But there is some there is some controversy regarding it. So it's discriminating and things like that. So
Yeah.
they have now that rule is not there, but still in many countries they use that rule, because the problem is the women themselves sometimes don't know they are pregnant.
Yeah.
And then there is a liability issues, a lot of other
Oh, yes.
issues,
Yeah.
attached to that one.
So for standing in an operating theatre, is there a higher risk posed to when they're not pregnant? Is there a higher risk to women? If
If they are not pregnant, no. It's just the pregnancy that makes them more vulnerable.
School, when I was doing my thesis, they were doing X-rays and it's surgery, and so we had to wear lead apron.
Yeah.
And they gave us a big chat prior about how if you haven't had children, for females, it's a lot more dangerous because it can decrease your chance of fertility. And then my flatmate, she's studying to be a radiologist, and she said when they need a radiologist in surgery, they always ask if the women feel comfortable doing it, how many they've done, because even though they wear lead aprons, that there's still a high chance. And awkwardly ask about the pregnancy thing as well, because it's not tense not something you should say, are you pregnant? Are you having another
Yeah.
kid?
Yeah.
And so the women have to be a lot more like open than you'd normally have to be in a work situation about it.
Yeah, true.
Like, especially if you're trying, but you don't want to tell anyone.
Yeah.
Yeah.
But regarding the sterility, it's too gray.
Mm.
So, yeah.
Yeah.
So that one is a deterministic effect with this.
Yeah,
sterility thing.
deterministic
Yeah.
effect. Yeah. But if the woman is pregnant, then it will create a stochastic effect to the fetus and then fetal anomalies and things like that. So,
Yeah. I think we should get our surgeons some lead glasses. The good ones
yeah,
anyway.
true. Because,
That
yeah,
would be great. They never wear them.
No.
But we want to keep
Yeah.
our eyesight good.
yeah. For example, interventional radiologist, interventional cardiologist,
Yeah,
most of
right.
them will develop cataract after 20 to 25 years. So it keep on,
That explains
Yeah.
a lot.
Full eyes coming.
How many times has Paul Sally had a cataract operation?
Yeah.
About 3, I think it is now.
so that part is always neglected because I haven't seen a lot of people wearing lead glasses as compared to lead apron.
Yeah, you might.
Yeah, and thyroid as well. Yeah.
What about like the patients in that situation? So if you're getting like an X-ray, because I've had like X-rays where they'll, like off the shoulder and they'll put like a lead apron on me for that, but like I haven't been given glasses or anything. Is that something that you can ask for, or is that?
As a patient,
Yeah.
hey, you can ask. Yes. I mean, ideally, they should expose only the part they want
Yeah.
to, image. So there should be a lead apron or lead seat over here, and only the shoulder should be exposed. But generally, that was a bit neglected part because there is no dose limit for the patient. It's justification and optimization, legally. So if doctor justify, the physician can justify, that's enough in the court of law.
And the thyroid, again, but that's just particularly susceptible. That's why they
Yes.
we have collars.
Yeah, true.
And like when I was growing up, my mum always used to keep pushing me on it. That like, oh, you're going and getting an X-ray, or you're going and taking another X-ray for treatment or checking things up. Make sure they go on Shield
Yeah, Bernard.
Yeah. because there are those tissues that are more sensitive and
Yeah,
radiation
true.
can build up.
Yeah, true.
Those
Was it-
of you who do active sport or break yourself. Lee Morrison.
Oh, yeah.
I'm pretty
Can we go a little more corner over there?
Yeah.
Yeah. The last few months.
Pretty safe with my knitting needles, I think. I don't know, maybe.
No.
Touch wood.
I realize this is quite scary, and this is something we need to take consideration of. But also, did you want to cover sort of radiation exposure just generally in the environment? Because from the sun,
It's the background radiation. Yeah.
5G.
Playing.
So
Now we've been injected.
Yeah.
We're all,
So-
we've got 5G and that's
so the rule is all deterministic effect and the threshold is in gray. It's in milligray, and the environmental we call background radiation. So that is terrestrial radiation, that is cosmic radiation, and in many part of the world there are radioactive mines and things like that. So that is another type of radiation. They are all in milligray and microgray. So basically there is there, and as far as stochastic effect is concerned, it depends. The probability depends upon the dose. However, it can occur with small dose as well. And so this dot line is actually due to background radiation. So that is why it is dotted. Okay. So we might get a lot of stochastic effect and a lot of cancer because of radiation without going any X-ray or CT scan. And one of the organ is very vulnerable is thyroid. A lot of people get thyroid cancer without hope. However, we just have to remember that the probability of getting that defect depends on dose.
But then if there's a bit of benefit risk.
Yeah, and
Guidelines,
yeah, and when we talk about benefit, it's not only the benefit to the patient, it's the benefit to the society as well. So if there is some industrial X-ray, but as a whole society will benefit because of the financial gain or economic growth, then it is again accepted, which is again justified.
Isn't there a pill that you can take? I think it's more not so much X-rays, but just exposed to really high levels of radiation. I forgot. It's just like an element that
Was it iodine? Or?
Yeah, iodine. It's supposed to displace the radioactive version in the chest or something. Do they do anything with that?
Ah,
It's thyroid related or something. I don't know.
So I do make you blocked up.
Sure.
But didn't they, those people at Chernobyl, when they something like that?
Or around when you get high levels, I think it's. I don't know. Maybe it's for far higher doses than you see in.
yeah, I don't know about that pill. Those- Yeah, maybe some research going on. Yeah.
Just in case you pitch techniques to
Lick and
Chernobyl. Well, Fukushima,
nuclear reactor,
coal miners.
Yeah.
Coal.
university campus.
Yeah, I've got a reactor because we got hold of a stick of uranium when I went to school, like depleted uranium. I'm pretty sure it's uranium. No, that's one thing they said. They said it's all right as long as you don't ingest it.
Yeah.
They said you'll probably be fine. Just wash your hands after and don't collect the uranium.
That's pretty dodgy.
Yeah, it was for a physics trip. It was sweet, heavy.
As if you
Yeah.
forgotten and accidentally bit your nails.
I think that I don't know. I think the risk was probably pretty low.
Yeah,
I don't think they were,
true.
I don't think they were going to let a bunch of 16-year-olds mess around with some dangerous uranium.
Wow.
Thank you for the guidelines as well. It's good to know about the guidelines and what to sort of think of with that 2 steps back as well. And just keep in mind.
Yeah, and the simple thing like just making a distance from the source. It's a very basic thing, but then
Oh,
Interesting, thank you.
Yeah, thanks very much.
Thank you.
Thanks again.
Any questions there?
Thank you. Yeah, all good. Thank you.
Thank you.
Okay, bye.
I didn't know, man. Where's Isabel? We need to get that now.
Oh, that was brilliant.
What's that?
Oh,
Sorry.
yeah, you do that, and then put that also step to.
Yes, it did record. Oh, sweet.